Right. Good morning, everyone. Good morning. Good morning. This is Szenan from Center of Balance, the acupuncturist. I'm Szenan from Center of Balance, the acupuncturist, and welcome to Center of Balance Live. Now, live today, we're going to talk about lower back pain diagnose. We've been to what is lower back pain, then what else? Lower back pain causes, lower back pain symptoms. Now today, yes, we need to know how do we diagnose lower back pain. Good morning, Eric, and good morning, Veronica. We are here waiting. That's great. Thank you. Good to know that. Okay. Yeah, I have to set up every morning. I have to set up a few platforms. I have four camera in front of me. Then 1, 2, 3, 4, 5, 6, 7 different platforms work together with 4 camera. Yeah, so one of the camera take care of 4 of them. The other have one of them each other. Hi, happy day. How are you? Thank you for joining us. So we have practitioner here. We have what? Patient here who are not practitioner, but they want information. Okay. Okay. First thing I want you to do, like Eric and Veronica, and happy day. Every time when you come up, I appreciate you. That's me. That's to say hello with me. Then I want you to give me a thumbs up. Then tag your friend into this live video, as well as share this live video if you're on Facebook and Instagram. If you're on YouTube, yes, do the same. Thumbs up and say hello to me. Then after this live video, please share this YouTube link on your social media. Thank you very much. Thank you, Veronica. Right, let's start because I have to get quickly get it done today because it's about 7:15 and 8 o'clock. I have to take my mom and dad and friends to temple today. So every Sunday we back to quite normal right now, and we go to temple every Sunday. I know a lot of you probably go to church or temple on Sunday as well, or Sunday maybe your relaxed time. In a lot of country or family time, but in our country it's still in lockdown. I wish that coronavirus will be controlled very, very well in other country like New Zealand and Taiwan and Thailand as well. We're doing quite well with that, and appreciate the government that take care of this matter and take care of the citizen. And I hope the other countries will get rid of coronavirus soon. Right? So bless you if you're in one of this country, and stay safe and stay awesome and stay healthy. This is a good chance for you to go online, and I'll give you every day. I'll give you some information. Now, back pain diagnose. Now we all know about, if it's a structural problem, what do? We need X-ray or blood test, MRI, CT scan, right? Yes, but before that, you don't go straight for those. You don't go straight. Okay, we as a physician, like as a practitioner, we all need to know how to give a physical examination. Okay, your GP, general doctor, acupuncturist, chiropractor, osteopath, physiotherapy, even massage therapy. But of course, massage therapy is not they may not be able to do that. Some of them, but some of them do. They have medical knowledge. They know how to do physical examination. And guess what? If you're a practitioner, you're not sure how to do those. It's been for a long time out of school, and some of the examination you're not quite sure how to do that properly. Go back to the textbook. The more easy way to go with on YouTube. As long as you know what the name is, how to diagnose back pain, and just go there. And physical examination on YouTube, a lot of amazing practitioner, they share how to diagnose, and this is great. Sharing the information, sharing the knowledge. This is great. So I'm here to share the information and knowledge. And on YouTube, you can learn a lot as long as you want to learn. You want to learn, okay? And just go to YouTube and YouTube it. I'm not saying everything that in YouTube is good information, it's right information. It may be not right, it may not right for you, but hey, get the information from YouTube and or go back to the textbook. All right. So the diagnosed back pain, first thing first is examination, physical examination. So now what do we ask? What do we ask if it's a back pain there? So we're going to find out now, do you have ability to stand or walk with your back pain? Now, we say, well, do you feel your back? This is how I ask, okay? What is the position that make you worse? Or what activities that make your back pain worse? A patient may say, well, I'm standing. It's not good. Walking is not good. Running, I can't run. I can't bend. That's very common. Very common. I can't sit for a long time. Or I can't sleep. It keep waking me up. There's no comfortable position. Those 6 things are very, very common. Bending to pick things up. Bending forward. I can't bend. I can't pick things up. That's one thing. Now, I can't sleep at night time, which means they can't lay down. As soon as they lay down, they get back pain. Some people, I can't stand. I have to sit down. I have to lay down. Opposite. I can't walk. I can stand, but I can't walk for a long time. As soon as I walk, with a few minutes, I get pain. Right? Or I can't run. I can walk. I can run, but my exercise running every day. Then this is something that affected. What the others is can't remember the others. Okay, those few. Okay. Then the range of movement. You need to find out. The most question we learn, and this question I learned it from Jimmy. Jimmy said, well, it is truth. It is truth. Okay. When I first start acupuncture treating patient, and we always ask, oh, where is the pain? And then we start to get needle patient. But hey, guess what? Patients are not coming to you because of pain. Patient coming to you because of something, because of pain that preventing them to do something that they want or they love. Okay, it's something that in their life they can't do it, they couldn't do it anymore, or slow them down. They are not enjoying it anymore because of the pain stopping them enjoying it. because of the pain preventing them doing what they would love or what they want. You know, does it make sense to you? So this is something that I ask. So what we used to ask patient will come, oh, I'm here for back pain. Yes, you're here for back pain. But what is the real reason you're here back pain? Because a lot of people have back pain, they don't get treatment. They ignore it. They live with back pain. Why is that? Because that back pain, I start in the morning, I feel some pain, and as I walk, have a shower, the back pain gone. I have back pain, but I don't need treatment. You see what I mean? But I have back pain in the morning. I get up, very difficult to get up. I can't go to the toilet. I have to spend half an hour to get up and then to start my morning. Then here you go. This person lost half an hour every morning. I have one patient who kickstarted his morning 1 hour. Every morning, 1 hour, he started, he has to crawl on the ground, on the toilet and everything. About an hour, then he can stand up to do things. That was many, many years ago. He had cooked spine ever since he was young. An hour. Right? So many reasons behind it. You need to find out if you have acupuncture. For patient, you know it. You know? And if you're a patient, you know it. You won't go to any practitioner if your condition doesn't stop you doing things that you want or you love or you enjoy. Does it make sense? Okay. Secondly, we're going to check the range of movement. Range of movement. All right. So bending forward. Bending forward, we need to check. Now, bending forward, not everyone are the same level, right? Normally, we say, well, we can bend 90 degrees or even further, but not everyone can. The flexibility of everyone is different. And some can touch the toes, some can't. Some only can touch the knee. So you just need to figure it out. And backwards, bend backwards, go backward, then go sideways, then turn, right? Turn back like this, right? This is all a range of movement. What else? What else? Now, get the patient lay down and do some tests. One leg, put on here, and push the knee as well as here to see whether there's any pain. That's examine the hip bone, and get the patient one leg, take up this leg up itself, whether there's any pain, and put it down, and how far can it go, and the other side, are they all the same? Yes, most people can get to 90 degrees or even further, but not everyone. Some people very tight and hamstring, they only can come to here, and that's okay as long as both sides are the same. Not everyone needs to be the same to 90 degrees, right? So if in one side have pain, then you have to go put the leg down a little bit and push the leg over here and see whether it affects the sciatic nerve. Okay, so there is all sorts of examination. There's a few of them common tests in lower back pain. Okay, the leg strength, right? If there's a sensation problem, thinking numbness, what are you going to do? You're going to get the patient, close the eyes, all right? Then use your hand. Normally, I use my fingernail on that side. At the same time, both sides go through the skin like this. Are they similar? Or on the legs, on the toes? Most common on the toes, pencil needle. So you get on the big toes on both sides, on the same area on both sides, scratch it. Ask the patient, what do you feel? Are both sides the same feeling? Is it yes or no? Right. Then keep doing those for all the area. And then to figure out which side is numbness and what is the level of numbness. How do we measure pain? Well, pain is the patient feeling. As a practitioner, you don't know, you can't feel it, right? Can you feel the pain, patient pain? You can't feel it. You can see from the face when the pain, oh, I'm so painful. You can see from the face, but you can't feel it, right? Yes, no one can feel patient pain, you know. So what are you going to do? How do you measure it? So all this physical examination are very important. Why is it important? Not just diagnosing the patient. You are actually need to take it down, because after treatment, especially acupuncture, right after treatment, you're going to do all this tests again. For what? For testing it out, measuring whether the acupuncture work or not. If the patient can't bend down, they can just bend to here. And after acupuncture, they can bend here. Good. Acupuncture work. It improves your range of movement. And the patient go back, oh, it hurt. Then you needle it, and the patient start to go back, oh, pain's gone. And they can go even further than acupuncture work. Then the next question, what's the next question? We always say that. Then now we find out acupuncture is working for you. That's great. That's awesome. Then the next thing is, how long does it last? We expect the pain come back. We expect that the range of movement was now it's in here. We expect it maybe come to here next time. It can't go any further. We need to know that measurement. Okay, we are not telling patient that, oh, acupuncture work, now you have no pain, then the pain gonna stay away forever. That's not true. You know, we are only testing whether acupuncture is suitable for you, whether you respond to acupuncture or not. Well, this is important, right? Pain go away straight away after acupuncture. You get instant relief. It doesn't mean you fix it. It doesn't mean you cure it. It only means that acupuncture works. Does that make sense to you? Okay. Now, the pain level. How do you measure the pain level? We ask the patient, out of 10, 0 to 10. 0 is nothing, no pain at all. 10 is unbearable pain. How it is, the pain level. And the patient will tell you, oh, it's about 6, it's about 7, you know. So patient make the call. We don't tell, we don't know. Then the next time when patient come, we ask it again. So each time we use pain level to measure. But pain level is just one thing. What about range of movement, right? We keep talking about it. Now, it is so this is something that, you know, you need to collect the information to help you to diagnose. Okay. Now, if a serious condition is suspected, so you as a doctor, as a practitioner, might order other tests. That's including MRI scan, blood test, urine test, all this thing, right? A CT. Now, and here in New Zealand, when you practice in New Zealand, as an acupuncturist, we can't order any test. Unfortunately, this is what it is. This is what it is, right? The thing that we can order is ultrasound. For shoulder pain, we can order an ultrasound. That's the how far. This is the furthest we can go, right? Now in Malaysia, because all private clinic, the acupuncturist can order MRI, X-ray, even blood test. They work with other clinic, work with the lab. But in here, because the government pay for everything, you don't have to pay for any test. The government pay for it. So all the lab basically owned by the government. Yeah, they all operate probably separately, but they get fund from government. They may be private lab, but they get fund from they get however the patient they get, and they get money from a government. So all by controlled by the system's different, very different. Okay, so Um, we, as an acupuncturist in here, we can't refer patient to get X-ray. And even some doctor, medical doctor, if it's serious back pain, they have to refer to specialists first, sport medicines or some specialists, and get a specialist to get a examination, physical examination. Then the specialist make the call whether they need X-ray or MRI or CT. Okay, this is how it is. Okay, in China, simple. All acupuncturists allowed to prescribe MRI, CT, blood test, uh, X-ray, everything. So the system's different. In China, in the hospital, you can do everything, everything as an acupuncturist. So blood test. What is important for blood test? Blood test, if it's infection in your spine, then the white blood cell will go higher. So we need blood test. Now, if there's kidney infection, urine infection, then we need to get urine tests. So all this is try to rule out the underlying issues. It's not a muscle strain. It's not you're not hurting the muscle or tendon or this problem. So you run a blood test and urine test, but not everyone. If the patient has hurt the back, they have a history of activities, and after that they get pain, or while the activities they get pain, you won't go to run blood test. You won't go and run urine test, right? If there's no reason, they don't know what happened. It just suddenly come, and with urine problem, pain, burning, then you run a urine test. Does it make sense to you, right? If all the physical examination you do, and you suspect, wow, when the leg come up, it's go pain, and pencil needle go down there and with sudden nerve, and then you refer to X-ray or MRI. You know, X-ray or MRI. The um, more accurate is CT, right? But hey, not CT is very expensive, and if it's not necessary, don't do X-ray, CT, or MRI. Why is that? Because now in New Zealand, that's what I heard from a colleague. They don't, if the young people, they don't order CT or MRI straight away. You know, if you're a kidney stone, you go to the hospital. They use an ultrasound first, but we know CT is going to be even accurate, more accurate, but more expensive. That's first thing. Secondly, you may get cancer or tumor in 10 years or 20 years. There's a risk of it. So they try to avoid to use CT. This is the reality in New Zealand, in the hospital. In the hospital. So we heard from the emergency doctor, you know. So they try to not do as often. If they can avoid it, they avoid it. Bone scan. Why bone scan? To see whether you have any what do you call it? Osteoporosis. Bone scan. Because osteoporosis cause pain as well. Okay, so this is something that I don't know about your country. Can you prescribe the test at all? Hi, happy day. You have a patient always complain pain at GB 22 down to GB 27, and the pain extend to lower back. At time, what strategy can I use to treat her? GB. What can treat GB? Hi, Alison. How are you? What can treat GB? What can balance GB? If we go down to lower back at time, from where complain? You see, I don't know about GB 22 though, because I don't know GB 22 is. Let me Google it. maybe 22 point is global letter 22. Chinese name. I need to know Chinese name. Oh, okay. And it is 27. Okay, Usu. Okay. Pens from here down to from here down to here. Then that's simple. A simple strategy for you. You can use is from here down to here, right? Which means from here go down to here. So use hand 三焦, hand 上扬三焦, and palpitate the ulcer point. And when there's ulcer point, put one needle in. Ulcer point, put one needle in. That's it. From here to here, from here to here, it treat all the trunk and the legs and lower back. From here to here, get the ulcer point. Right. This is local balance. So very quick one. Okay. Now that's it for today. Tomorrow we're gonna talk about treatments. So this is just talking about overall back pain. Okay. In the future, we will talk about what herniation does. How do we diagnose it? What is it called? Why is it called herniation does? And then we're gonna go to more deeper each different back pain. All right. In the future, we're gonna go step by step, step by step. Now it's just talking about all over things. Back pain, all this back pain. How do you diagnose it? What do you use to do that? Something like that. Okay. Keep it simple. Give you some information. Keep it simple. Then in the future, we're gonna talk about all different back pain and headache as well. Tension headache. What's tension headache? What is good? What is the cause? And what is the symptom? And how do you diagnose it? How do you prevent it? What is treatment? What is the home remedy for it? All those things. Right. So tomorrow we're gonna talk about treatment. When it comes to treatment, which means I'm gonna show you some acupuncture point, acupuncture strategy to share with you. If you're an acupuncturist, that's gonna help you a lot. If you're a patient, the acupuncture point you can tell it to acupressure point, right? And when it comes to home program, it's something that you can do at home. I'm going to show you acupressure point, some other point that is easier for you as a patient to work at home rather than for acupuncturists. So there's a different strategy. It may be different strategy. It may be the same strategy. Okay, we'll see when it comes to tomorrow and next day. Treatment, home remedy, and then the other day we're going to talk about prevention. So how many topics we go to every time? Let's see. We got 1, 2, 3, 4, 4, 5, 6, 7. Now in this back pain, we're going to go up to seven little topic, which is a week. We spend a week to talk about just back pain. Then next week, we're gonna talk the other topic, right? So one in a week, right? Stay awesome is 7:40 now. Then I need to go. I need to set up everything, and I have to go now. Right? Thank you, and stay awesome. Pray for us. Yes, I will pray for everyone. That's what we do. We go to temple and we pray for everyone, not just ourselves. And we pray for local people who live in New Zealand, and we pray for everyone all over the world. This is, sending out the love and pray for everyone is something that we can do. When you pray for everyone, you are giving away the wish, and you are creating the most powerful energy in the world. People didn't realize that. Okay, and this is important. Pray every day, no matter who you are, what the religion you are in, and just pray every day and wish everyone well every day. Right. Stay awesome, and I love you all. See you. Bye bye. I'll see you tomorrow. Hmm.